The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, unique approaches used at the center. Your presenter, Chad Creer, ND, DC.
The goal of this was just to kind of let you see some of the things that we do here at the center, some of the different unique therapies that we offer. A lot of times people say, well, I didn't know you did this, or I didn't know you did that. So we want to kind of go through a little bit of what we do out here. What I think of the center, I think of using nature to get us back to health. And so when you think of the word physician, it's from the Greek root meaning nature. Yeah, so physician actually means nature. We've kind of gotten away from that lately, but Hippocrates did teach that nature is the healer of all diseases, or in the Latin phrase, vis medicatrix naturae. So, and if you think about that, if you put that in there, at some point they put physician is the healer of all diseases. If you think of physician as nature, but really, I don't think of doctors as being the healer of all diseases. It's the body has an incredible capability to heal itself, but we can utilize natural therapies to help it improve that way. This was what Dr. Rana told me several years ago when people would say, what do we try to do at the center with each new patient? And this was the answer Dr. Riordan gave. He said, we're attempting to characterize the biochemical uniqueness of each individual. So we're trying to understand the patient from the inside out and trying to understand what makes each individual unique. And by looking at their biochemistry, we can come up with some different parameters that make them unique. Just an overview for those who've never been here. What we generally do with new patients is they come out here, they will visit with us for 2 or 3 days, and the first time that they're out here, they'll meet with the doctor, sit down, the doctor does a thorough history. That generally takes about an hour, and then we do the lab evaluation, and that's where we're trying to really identify the biochemical uniqueness of each individual. So, and our laboratory testing is unique in that we look at nutrients, fatty acids, all kinds of different parameters in the blood. And then we do a physical exam, so that's another 45 minutes to an hour on top of meeting with the doctor. So really, one of the things that separates us here is we try to get to know the patient, try to get to know your what's going on with your family, what's going on in your social interactions, what your diet's about, and then really finding out what you're all about on the inside, so looking at your biochemistry. You know, the whole point of doing this, all these labs and looking into the biochemistry of the body is we're trying to identify the cellular and biochemical malnutrition that may be taking place inside of your cells. We know that we need certain things for our cells to run efficiently to give us fuel for our body. And if we're deficient in just one thing, it can create a chain reaction. If we're deficient in many things, then it creates a whole host of problems. So once we're able to find out what we're deficient in or what we have excesses in, we want to try to support the body's natural healing capabilities by giving the right molecules to balance the body. So we've termed this orthomolecular medicine. And ortho means right. Molecular is molecules, so trying to use the right molecules to bring the body into balance. And basically you can say we're using natural molecules, so again, natural medicine, physician is nature. Well, we want to talk about some of the different things that we do out here, some of the different procedures, whether it be therapeutic or whether it be diagnostic tools. I wanted to just have a look at some of the different things that we do. So most patients when they come out here will have the chance to have auricular therapy done. We'll do something called biofeedback and biological age testing, and also nutritional counseling. With auricular therapy, basically this is just a non-invasive form of low-grade electrical current applied to the ear, and this was started probably in the late 40s to early 50s by a French medical doctor, Dr. Noget. And the reason he started this was he had a patient who had a lesion on his ear, and the patient wanted that lesion removed, basically just a mole. And when he removed that mole, the patient came back about a week later and said, hey, I don't know what you did to my ear, but the back pain I've had for several years went away. So he thought, well, maybe that's, it's probably just coincidence. But then he started removing lesions on ears, and pretty soon people were saying, pains are going away. He started to think, well, maybe there's some sort of connection between the ear and the rest of the body, and then all of a sudden he just delved into the research on that. And pretty soon he had a map on the ear that corresponded to the human body. And basically, if you think of the ear as an upside-down body with the head at the bottom and the feet at the top, we can send signals into the ear that go to the brain that then send signals to the rest of the body and get some effect, especially for relief of pain, just by treating the ear. So what it does for us is it gives us a way to actually map the ear, find out where there may be some imbalance at different points of the body by looking at the ear, and then actually applying some low-grade electricity to that part of the ear, and hopefully having an effect on the part of the body that corresponds to. So basically you just use an electrical device, and we scan the ear. The electrical device has two dull probes on the end of it that measure the electrical difference between two tiny points on the ear. Any area of higher resistance, meaning that there's some sort of electrical imbalance in that area, will give us a reading on the graph. If the reading is really far off, then that tells us there's some sort of imbalance in that area, and we generally treat that area. Mostly what I've used it for is pain control, pain management, pre-surgery pain control, and anxiety. Well, another thing we do out here is biofeedback, and the type of biofeedback that's largely used is called autogenics. So auto is self, and genics is just basically creation, so it's a self-creation. We used to think that our autonomic nervous system was completely out of our own control. Well, we now know that we can self-control our autonomic nervous system. We can be trained to do that. And so autogenics is a process that allows us to try to train our body to control things. Just some examples of autogenic training are when they teach you to relax certain parts of your body, make certain parts of your body feel heavy, then make them feel light, try to make certain parts of your body feel warm, try to make certain parts of your body feel cold. All these different things, those are a type of autogenics. You can also use hand thermometers where you try to warm up the hand thermometers. You can do oral thermometers. You can do heart rate monitors where you try to change your heart rate. You can do things with sound. But all these different things are autogenic. And the whole point of this autogenic process is trying to restore balance in your autonomic nervous system. Your autonomic nervous system has two dynamics. It has the parasympathetic and it has the sympathetic. So the parasympathetic calms things down. It's your rest and digest type of nervous system. The sympathetic speeds things up. It's your fight or flight, get up and go, run from the tiger type nervous system. So the whole goal with autogenic training is to hopefully put you in more of a parasympathetic rest, digest, healing mode and take you out of that sympathetic fight or flight, run from the tiger exercise mode. Another thing we do out here that some patients really like and some patients really hate is the biological age testing. We're looking at what your functional age is versus your actual age, your chronological age. We know that quality of life depends on our ability to function. What good are we if we can't function as we get older? We all hope that as we get older we're able to have some sort of function. So this biological age testing just says, well, you're either heading up the right direction, or well, you need to back up and make some changes in your life because based on this test you're moving in the wrong direction. Okay, so a big part of what we do out here is nutritional counseling. I'd say that's a huge factor. All patients who come out here are asked to fill out a 7-day diet diary. That gives us a lot of information that we can punch into a computer, basically all the foods that people wrote down for 7 days. We can punch that into a computer and then get a good idea of their macronutrient intake, their micronutrient intake. So macronutrients, the biggies that give us calories, carbohydrates, proteins, and fats. And then we can look at the micronutrients, the vitamins, minerals, amino acids, all those good things. Also tells us a little bit about their fiber intake, and just gives us a good idea of whether they're eating whole foods, foods that are intended for us to eat, found in nature, or if they're eating a good amount of processed foods.
To learn more about the health, education, and lifestyle services we offer, please visit www.riordanclinic.org. Call 316-682-3100 or stop by 3100 North Hillside in Wichita, Kansas. spreading an epidemic of health worldwide for over 35 years. Contact us today and discover for yourself what only we, have